Please help me welcome Eric, Tim, and Chris.
And we're actually going to leave Eric down there for a little while so he doesn't distract everybody. And so we can talk for a little bit before he gets to talk, which is more fun, I think. I'm Tim Knox. I'm a systems engineer at Jamf. I was focused on the healthcare industry for about a year and change. I was lucky enough to help work with the Healthcare Listener and helping get it implemented. And Chris Ball, professional services engineer, is that the right title?
Yes.
Nailed it. He is one of the guys who actually implements the work. So all I have to do is come up with the ideas and talk to the customers. He's the one who actually does the actual work on the back end, and then Eric does the actual, real work with the actual human beings that's actually being impacted. So I'm going to give a little bit of a brief overview about what the setup and reset app are. I'm sure some of you have seen it already. Hopefully you guys were at the session yesterday at 1:30 and the interactive lab at 4 o'clock yesterday. If you didn't, well, there's a recording. You can't go back in time, but you can watch the recording. I am going to just make sure everybody understands where it came from. Then you're going to talk about how it's used in other healthcare systems other than UC San Diego Health, and then we're going to bring him up to go into a deep dive. So here we go. Oh, you know what I think I just did? I think I just talked about my agenda. That's us. Just talked instead of using slides. And this is the agenda. We're going to do the thing I just said, now with slides. We're going to do the overview of the apps, like I said. We're going to talk about the changes in healthcare, and then we're going to talk about, I didn't change this one. I checked everything. I'm so sorry. That should say UC San Diego Health, not UCSD. So, setup and reset. These are apps that we developed really coming out of the healthcare world. It was talking to nurses and clinicians and healthcare people about what they needed to help impact patients' lives and what could actually help them make a difference in the world. And we built this stuff and we tested it in a bunch of places. Ball's going to talk about that in a little bit, but here's basically the idea of setup for the people who haven't seen it yet. Talking about provisioning a device from a device. And there's a basic roadmap that all devices take. It's going to be setting up the device, assigning it to a user, configuring that device, and then resetting the device. That's a pretty common provisioning milestones. In the setup, you need to have the automated MDM enrollment is required. We want to make sure that in the healthcare industry, we're not keeping PHI or PII on the device. I know that Eric has a little thought on this that we're going to get to later about how the apps are actually interacting, but we'll get to that in a bit. And really, common shared tasks are the most useful. The idea being, with setup, all we're doing is hiding and unhiding apps. So the apps actually don't get removed from the device when you're switching from one role to another role. So if you were to switch from something that contains PHI or PII from one user to another user and that login persists, setup may not be a best option for you because we want to make sure that that user gets logged out. We want to make sure that PHI, PII gets removed. We want to make sure that we maintain all those happy HIPAA compliances. But that's why reset exists. Reset is really going to be the one that helps clear that out. So in order to configure setup, and we went into greater detail about this yesterday, I'm just going to touch on it a little bit. The idea really is we have one smart group per use case so that when you create that role and you make that selection, it drops into a smart group, which then starts deploying the right kind of settings for that user. We're going to have one global setting for home screen layout because it only supports one, so we can only have one. And then optionally, you can change the wallpaper. We find that to be really easy to have a very clear indicator for the nurses or clinicians or patients to see exactly what that device is actually being intended to be used for. So it says on it, phlebotomy, or whatever it might be. Reset is really what it sounds like. Reset that device back to square one. It is designed to wipe the device. It's a big red button. Big red button. We heard that all the time talking to nurses and clinicians in the industry. When we would go in and talk about the healthcare listener, and we would say, this device, this healthcare listener will listen for your ADT message, it'll listen for your HL7 feed, it'll wipe the device on that discharge command, and the nurses all said, can we do it ourselves just in case? And we were like a big red button? And they said yes. And so we built the big red button that does that one thing. And it's designed to really work in tandem with it. And you're going to go into greater detail on that. We don't want to use it instead of the healthcare listener. Using it in tandem with the healthcare listener is really optimal to be able to have the automated workflow and then have the manual emergency eject button for peace of mind. I guess this is you. You want to talk?
Sure.
Great.
Sure.
Here's
Thank you, Tim.
Yeah.
As Tim said, my name is Chris, professional services engineer with Jamf. I had the opportunity to work with multiple healthcare institutions this year, particularly with the Bungie Foundation, where I was able to work with both of these apps in their infancy. So let's begin by talking about Jamf Reset and how you can utilize that in healthcare. Well, like Tim said, this is something that we had heard from healthcare staff People that had day-to-day use of these devices, they really wanted that big red button, just a way to enable staff, but not only staff, but also patients and their parents, in the case of children's hospitals, the ability to press this button, have that peace of mind, knowing that any data or information that they had added to the iPad will be erased. It also is going to greatly simplify your reset workflow if you were wanting to have hands on the device to reset it, going through settings, general reset, erase all content and settings, maybe isn't the easiest for everybody, certainly not in children's hospitals. So the big red button, it's obvious, it's on the page, it's simple, people like it.
It's even easier if you're medicated, for example.
Yes. A great part of this is that because it's enabling users to wipe the device themselves, we don't have to have carts, we don't have to have IT involved in this. It's really a user-driven process. Like Tim mentioned, this works great in tandem with Healthcare Listener. Think of it a bit like a belt and suspenders. You have your safety net in the background of Healthcare Listener in case you want to press that button, or if the patient just isn't sure, they don't trust the process, they have an easy option to erase it themselves. Here is just the default view of what Jamf Reset will look like. You'll be able to configure this.
It's a big red button.
It is a big red button. I think it looks pretty good, but I think that you can make it look better. And we'll talk about how you can do that in just a little bit. Next, we're going to talk about Jamf Setup. But before we get into that, I'd like Tim to kind of set the stage and tell you how
sure.
Jamf Setup came to be.
Yeah, let's talk a little bit about Bungie, the Bungie Foundation, and what we did with them over the last year. So the Bungie Foundation, you may be familiar with them. They made games like Halo and Destiny. They have a Bungie Foundation, which is the philanthropic arm of the Bungie software. They wanted to put iPads in the hands of kids across every children's hospitals across the country, and we were pretty successful in that. Not every children's hospital in the country, but a whole mess of them. How many children's hospitals are there in, do you reckon?
I think it's about a dozen.
That sounds about right. And you were basically installed most of those, the Healthcare Listener. So the Healthcare Listener is that ADT feed message that we can hear and integrate and listen for that standard HL7 feed to be able to discharge and then erase the device. So what they wanted to do, though, was they said, what we really want to do is deploy games for the kids that were appropriate for their developmental age. How would we do that? Like, how could we make it so that we could select what developmental age they were, and then deploy the appropriate apps? And we were like, I don't know, maybe we can build something. And so a guy named Aaron Maxim, who's another systems engineer in Seattle, built this proof of concept for them that allowed us to make an API call to change an extension attribute within the Jamf Pro instance to define preschool, school age, teen, the children's developmental age, and then it would deploy that software based on that selection. It was really slick, it was really cool, and just at the same time, over in the hospitality world, they were making, Jamf was making something about how to select rooms on Apple TVs. And this little confluence of events of two different industries asking for essentially the same exact thing on different kinds of devices, we built it, which is really where Setup came from. And this app is being used still in all those children's hospitals. We anticipate once Setup goes real, well, I guess it went live yesterday. So hopefully Bungie will start using that stuff and really be able to brand it and make it look and behave exactly the way it is in a much more supported way. Really excited to have Bungie start using that.
Absolutely. Jamf Setup is probably the most exciting app that I've seen for iOS in a long time in terms of management, especially with Jamf. Bungie has shown that this is a great option for patient-selected configuration with the age range group. If you're elementary age, you can get elementary apps. The patient can select it, the parent can select it, but it's not limited to patient selections. You could also use it in a shared environment where healthcare staff, they come in for their shift, they might pick up an iPad, they'll select or use Jamf Setup to select their role to get a view of the apps that are appropriate for them. And then at the end of the day, they could turn it back in and the next person could come and use Setup as well. Also, you could use it for onboarding new employees for IT shops. You could have a general build. You have a specialist coming in. Maybe they're a child life specialist. You have a child life department. You can select that in Jamf Setup with the new employee and get them set up with the apps that they need.
After the session yesterday about Setup and Reset, I had a teacher come and talk to me afterwards, which really got my head spinning. He suggested using it for substitute teachers. Substitute teachers could come in and they could pick the class they're teaching, and at the end of that class they could nuke the device and it could be set up for them. The same exact thing could be used in healthcare for floaters. They could be a floater devices that when a clinician comes in from someplace else, they could select what it is they're going to be doing for that day, and at the end they could wipe that device and hand it back into the floater pool. Really, really cool. I'm really excited to see how this stuff is going to develop.
It's super cool. Once again, my favorite part is that we're taking the need for carts and IT involvement out of the picture.
Yeah.
You don't have to log in to the apps to use them. You don't have to.
Talking specifically about the healthcare app, not the not Epic.
Yes,
those
no,
apps.
no,
Stuff
no,
to log
sorry.
into those
Yeah,
ones.
yes, Jamf setup.
Yeah.
So it really eases IT deployment in terms of rolling new devices out or refreshing devices for a shared setup. And here is what Jamf setup looks like by default. Once again, I think it looks great, and I still think that you can make it look a lot better with app config.
Mm-hmm. And we have.
So both apps, they can be used in tandem with one another and also with the Healthcare Listener. They all work great together, but you also have some cases where you might use them individually. Maybe for tier 0 troubleshooting, perhaps you don't need the setup, you have just one basic build for iPads. The reset could still be useful in resetting things back to stage 0 on the fly.
I've managed a fairly sizable deployment in my life, and nuking an iOS device is always the fastest way to solve it.
Yep.
And if you can take that away from IT and give it in the hands of the user, even better.
Absolutely, absolutely. So I had talked about app config. If you aren't familiar with app config, this is how we're going to customize these apps. This is how you'll add your branding. You can change the verbiage. You can add legalese as you need. And if you're not familiar with it, take a look at appconfig.org. Encourage you to take a deep dive and really embrace this tech. Get to know the community, because we're really just trying to make iOS management and the user experience better. And with that, I'll turn over to Eric from UC San Diego Health, and he'll let you know how he's using both of these apps and the Healthcare Listener.
Yay, Eric. I'm going to hang out down here.
Morning, everyone. So just to give a little overview of what we've done, you've probably heard about it at a few of our keynotes that we've done here with Jamf. We did an initial 245 deployment of iPads and Apple TVs in each of our hospital patient rooms. We're averaging about 1,400 wipes every month, which everyone likes to talk about the wipes. I like to talk about that's about 1,400 activations through DEP and Jamf and all the apps deploying, and that being ready for the patient to use each month. One of the key pieces of data that we really like to talk about is that when a patient activates their tablet, whether it's for the room controls or whether it's for just watching Netflix, they're 30% more likely to access their patient data on the device using our deployed bedside app, which gives them access to their stay in the hospital as to what's happening, why are they there, go into a deep dive about the medications they're taking and the staff that is there to support them. Photos, not names scribbled on whiteboards. Mm-hmm. But this gives them a chance to or gives us a chance to increase the usability of them accessing their patient record by about 30% over those that are not using the iPad at all. So I don't know if any of you guys have looked at your Jamp Changelog. This is what ours looks like on a daily basis. This is a period of time, I want to say this is for a 6-hour period of time, and all we see are device wipes. This is all automated. This is all being activated, as you can see, by the Healthcare Listener. And it's just time and time again as each patient is being discharged, wipe, wipe, wipe. So this is something that's happening constantly. I really have to put in a feature request to filter these out so I can see what did I do in Jamf. So here you can see what we're doing with the Healthcare Listener wipes. I think you guys can see when we started to deploy the other 500 iPads that we've now put into our other patient rooms, besides just the Jacobs Medical Center. We can see that now we are rapidly approaching, currently as of last week, we're rapidly approaching 2,200 wipes. And I think now with what we've got now being able to deploy in the NICU and our other departments, that number is going to just keep continuing to grow. So as to the customization of the big red button, if you will, of Jamf Reset, here's what we've done. This is our first deployment. We're waiting to hear back for feedback and see what other text and other changes we'd like to make. But you can completely brand Jamf Setup and Jamf Reset to meet your own organization's style guide, make it match, deploy your logo, and get the fonts and the colors and everything else, or not the fonts, but the button color and the button text and all the other details to match. This is how we've got Jamf Setup configured for the NICU. And in this case, we're not doing Jamf Setup to change the apps that are deployed. We're doing this so that a nurse can pull a so I guess let me back up a little bit. Our NICU in Hillcrest is not our typical one patient per room environment. This is now a new facility that we've spun up and expanding our NICU. So we now have we still have our existing one in our Jacobs Medical Center, and now we have our new one in the Hillcrest Hospital. The Hillcrest Hospital's NICU is a large bay with a lot of different pods for the babies and the families to be together. In our case, we can't have an iPad in that bay. There's just not a way to facilitate that. There's no way to leave the iPad in the bay with the baby. Just doesn't seem comfortable. I really like the form factor, but it's not a good pillow. Mm-hmm. So we needed a way that we could then take those iPads, make them available to those bays, and then be able to distribute them. Again, our focus is on no involvement from the staff to be able to deploy these. Just like our bedside iPads, a patient's family or a nurse can go over to the charging rack, pull an iPad off, and then they're presented with the setup app here. They specify which pod that their child is in, and then that triggers the call to Jamf, which then sets the wipe trigger to match that room or that pod. So now when that baby is discharged, everybody's getting ready to go home. There's a lot of chaos in that. Do we have all of our stuff? We don't want them to worry about the iPad. They're just going to look over and notice that the iPad has already started wiping as they're gathering up their stuff because the HL7 is already taking care of that. We also have reset on the device because, as in a NICU, unfortunately, the baby may not be able to just go home anytime they want to. Parents may not be able to come in the next morning, may not be able to maybe come in that day. We want them to feel secure that their data is safe, so they have the big red button that they can initiate the wipe themselves, or when the nurses are collecting the device, they have one button to tap. So I talked a little bit about our Hillcrest NICU, how setup and reset work together with Healthcare Listener. The other advantage to having reset available is for all those areas where we do not have an admission, a discharge, or a transfer trigger the ADT feed to wipe the device. There's a lot of cases where you're getting ready for pre-op. You've sent your clothes, your phone, everything else. You're laying in a bed in a gown. You're getting ready for your surgery. and all your stuff is now secured and in your locker and in your recovery room. Now what? Nurse comes up to you and says, sir, sorry, we've had a minor delay. The operating room that you're scheduled to be in is going to be in use for, they're estimating, about 4, 5, 6 hours. Yeah, your doctor is insisting that we do this procedure today. It's important, but there's going to be a little bit of a delay. So what do you do now? You don't have a device. This is not going to be fun. No, we want to improve that experience too. We can now provide them with an iPad with all of our apps, be it FaceTime, everything else that we're already deploying to the tablets. Everyone likes to joke about Netflix, so I'll bring them up too. That we have now the patient can continue binging, watching what they wanted to watch on Netflix, Hulu, see what's going on, tweet about JNUC on Twitter. But yeah, so this is a great case for that. And then the patient, because they're not being transferred, because they're already ready, they hit the big red button and their data is wiped as they're getting ready to be wheeled into the operating room. The other thing that we have are folks who are coming and visiting us to receive transfusions in our outpatient pavilion. Those infusion and transfusion department may have a patient that's in there for 3 or 4 hours, maybe longer, maybe less. Those are also a great opportunity for the patient to have an iPad and have something to do while they're waiting for their treatment to occur. They probably have a phone with them. They could probably watch a video or something on their phone, but maybe that experience is a little better on being able to do that with an iPad. And again, having the Reset app there makes that really, really easy to make that possible. So I think what I want to do now is go into a little deeper dive on what we're doing with our deployment, talk a little bit about how we are securing those devices and securing the Apple TVs and making that a successful experience and an enjoyable experience, at least as best you can in a hospital environment. No one is going to a hospital for a vacation. There are some really great reasons to go to a hospital, like for childbirth, and that's a wonderful reason, not a vacation. We try to make the environment look as nice and hotel-like as possible, but we still have to have everything accessible. We can't just have a bunch of furniture around as it gets in the way. We don't want to have iPads on a mounting arm, gets in the way. We don't want to have a lot of cords or tethers, tripping hazards. So we want to have as much of this completely open and completely free as possible. Patients may not be the strongest people. We don't want to have the device in a heavy case. We have the device naked. There's no case on the device at all. We do have a microbial screen on the front of the iPad, and our environmental staff between each patient visit wipe down the device with a healthcare grade cleanser. And we've not had a single iPad damaged from the cleanser that we're using. I guess it's really hard to hurt glass and aluminum. So when a patient is admitted into the room, the tablet is sitting there at the setup screen. They choose the language that they want, choose the location, get the device on a provisioning Wi-Fi that we have. It's the only open Wi-Fi that's available. They tap that. The device then checks in to Apple, gets the activation to DEP. DEP sends them to our Jamf Pro server, and then Jamf Pro does the rest of the enrollment. During this initial time, we're using Cisco ICE to validate that the device that's connecting to the provisional network is a device that we know. It talks to Jamf to see, is this a device we've seen before? And Cisco and Jamf confirm. I don't believe that the Ciscos can see the serial number, not really part of what's released in the network traffic. So Jamf is able to provide that information and say, yes, here's the serial number of the device we've seen. Cisco validates that and permits continued access for that device on our network. Once we have the enrollment into Jamf, Jamf then sends down the configuration profiles, the screen background, the lock screen image, and then we have all of the apps start to queue up for deployment. Before the user has the ability to even open the bedside app, we've already switched the user from our provisioning network to our secured network. It's a hidden network just to not make it a confusing piece. We're not hiding it for security, we're hiding it for the experience. We don't want the user to have to pick amongst 50 different SSIDs to find the right one. We're in a hospital. We're not really able to control what other folks around us are doing, but we can control and limit what we are doing. So we try to limit those as well. Now we have a patient on a secure wireless network. No action needed for their part. It's all happened again. All the ICE piece is confirming, yes, this device is managed. We know it's there. It's active in Jamf. And then that gives the green light to Cisco to allow the device to remain connected on the network. From this point forward, we're also pushing out a configuration profile that matches the configuration we've deployed to the Apple TV. The Apple TV, each one of the 245 that we have, has a unique password, and that password is shared to that same room's iPad via a configuration profile. This way, when the patient goes to do AirPlay, they see one Apple TV. They only see the one Apple TV out of the 245. Conveniently, it's the same Apple TV that's in their room. We don't want to ever have a case where a patient might accidentally wake up another patient's Apple TV. We don't want to have a case where now that TV, when the patient was asleep, is turned on and is asking for a PIN code on the screen. So we've completely locked down the Apple TV to conference room mode. With the changes that we've gotten with iOS 12 and the VPP App Store, we're looking to expand that to be able to deploy all the same apps to the Apple TV as well. We're also able to, thanks to the Healthcare Listener and DEP, wipe those Apple TVs on discharge or transfer the same as the iPad. That would happen simultaneously, and the Apple TV would actually be set up long before the iPad is. iPad is sitting there at the setup screen waiting for the patient that comes into the room. The next patient that comes into the room has the Apple TV welcoming them to their room with a semi-user-friendly code on the screen. We don't want to fill the screen with too much text. So in a nutshell, that is that. I'm sure I've missed a lot of stuff that you have questions for, so please come up and test me and make sure I know what I'm talking about.
Yeah, I'm coming back up too. Yeah, we actually want to say that the apps, the specific apps, no, that's cool, are actually available yesterday, which is exciting. They are totally customizable. They're ready to download right now. Some of the stuff you talked about as far as like the infusion bays is exactly what we had reset in mind. When we were talking to nurses and clinicians, that was another big request was, well, yeah, the healthcare listener is awesome. We can hear that discharge command. We can hear that transfer command. But what if they're just here for a couple hours for an infusion bay? And maybe they don't have phones or tablets. Maybe they're an underprivileged community. And maybe this is an opportunity for us to level that playing field, be able to get technology in the hands of people who may not have the opportunity to have it anyway, and they're already in bad shape. They've already getting infused, and they're in a bad place. So let's help give people the opportunity to be able to have that experience.
And additionally, we're able to provide better medical information to those patients rather than letting them figure it out on WebMD. We're able to provide our own medical library and provide them and even distribute links to them for the departments that are relevant to them. For example, I love talking about the NICU and our labor and delivery departments. We have some custom apps that are deployed to our patients on those floors that talk about new mother training. everything from here are the key things to look for connecting your car seat before you leave today. Here's some important information on transporting your baby, carrying your baby, all these things that maybe a new mother and a new father would want to learn about, and those are also available on the iPad, ready to go. They don't have to do anything; it's just there for them.
And sometimes those families are in that hospital space for some time.
Yes.
I spent a little bit of time working at Children's Hospital in Minneapolis as a tech support, essentially, and yeah, those nurses in the NICU are very protective of that space, and be able to have some technology in there that's just in there for them, where they don't have to leave the baby, is incredibly cool. Yeah, you got a question over there. Solid.
So, when you guys did this, looking back, were there any big, gotchas or things that looked like they would be easy but turned out to be a giant nightmare?
Yeah,
Actually rolled out.
Quite a few.
Yeah.
How long do we got? Yeah. So one of the initial gotchas was before we did the provisioning network and had that built out, we had already a guest network, and the idea was that the patients would just use the guest network to get the device online, because we're always going to have that guest network. And I already talked about not wanting to have too many SSIDs in the system for people to pick from. So the initial thought was, I think the guest network is going to be good enough for this. However, because of the captive portal and the other stuff, we would find that a patient may think, oh, I've got time to do this, and then a nurse comes in or a doctor comes in to talk to them, and then they put the iPad down, and maybe they don't use it again. Now the device is sort of connected to the network, but it's in the captive portal stage, so it doesn't have a valid IP address yet, and so the device is semi-set up, but not. So that was a dangerous place to leave that tablet. Really, it's still in Setup Buddy, but that's not the experience that we want a new patient to come into the device. We want that hello screen, welcoming. We want the tablet. We want Apple helping us welcome the patient into the room with the other signage that we have in that room. So this is a dangerous piece to leave that tablet in. We couldn't remote wipe the tablet because it really wasn't even on the network yet. So one of those lessons learned was to get the device not use the guest network, but to use the provisioning network that we put a little higher up in the line than our guest network.
And secondly, how many devices have you had to swap out in the instance that something's broken, or how's that process? Honestly,
I think we've done a lot more of switching devices, or there's concern about a device not working correctly. Maybe there's a device that's been locked out by the Wi-Fi. Maybe ICE has gotten confused and said, oh, this device is not the device that it says it is. With some earlier issues with the MAC randomization that was happening, I think was tripping up ICE for a little while, and that was kind of locking the device from being able to connect. So we would have a technician just go into Jamf, switch out the room code for the new device they were bringing out, and then hand that to the patient to get that online.
And that's fairly frequently, or not very often?
No, I'd say that happens from looking through our ticket queue. I think that maybe happens once or twice a week. It's not really a frequent thing. And out of 245 instances, that's not that bad. I'm curious, as now that we've deployed to 750, if that increases, or if that the issues are reduced.
What's up?
Couple questions.
You brought notes. This is awesome.
Well, I was taking some notes. So back in earlier when you spoke about Bungee, are you hiding Jamf setup once the choice is made, in case a kid wants to go in and choose a higher age?
Yes.
Okay, you are.
Yeah, the moment that selection is, actually, maybe you want to speak to this?
Sure. So the moment that selection is made, an extension attribute value is changed. The device is going to enter a smart group, which is going to remove the setup app.
It leaves reset.
It leaves reset,
So you
yes.
can wipe it. All right. And then, Eric, which are the standard iOS apps are you leaving? You mentioned FaceTime earlier. You don't allow people to go use their Apple IDs to go purchase apps at all, do you?
We don't yet. but it is something that we are considering. We've done a lot of testing on this. Because it's for the patient's experience, we want to expand that as much as possible. We're not really seeing, we do some things like prevent screenshots, and we do some things to reduce the possibility of the patient accidentally sharing patient data. But we also want to be careful, especially as I keep talking about new mothers and maybe that iPad, an unexpected labor, they're rushed to the hospital, they don't have anything. Maybe they don't even have their phone, or their phone's dead, or whatever. We want them to be able to take that tablet, take pictures, take video of their new baby, and post that to Facebook. That is entirely the patient's prerogative. We're not going to tell them how to use the device. We don't tell people what to do with their own PII or PHI. That is theirs. If they want to share as little as or as much of that as possible as they want, that is up to them. If they want to say, "Hey, I am here," on my Facebook page, here's who I am, and here's what I'm being diagnosed with, that would be a HIPAA violation if we did it. It's not a violation if they do it. Gotcha. So really, we're looking at making as many apps available as possible. We've argued that opening up the App Store and letting the patient download their own apps would allow that patient to have a lower initial load time as we push out 3 gigs worth of apps initially to the tablet, each wipe or each setup. So, we have good bandwidth in our hospital, but at the same time, letting the users pick what they want. Right now we're using self-service for that, but we're looking to open that up a little bit more. There is an unusual case where if a user signs in, even for FaceTime, that device shows up in their list of devices. You can't really do anything with that, but it's an unfortunate experience for that patient when they're looking through and they're like, "What's this serial number? What iPad is that?" When they're looking through their own.
Sort of like lock or wipe command from that, can they?
No.
No. Okay.
And so, activation lock is disabled through Jamf, so these devices can't be activation locked. And if they were to choose to wipe their own device, that's one thing, but that device is no longer tied to them, so they can't wipe that device after they've left the hospital.
Okay. And you mentioned IT is not involved in the NICU in that one case when you have pod 1, 2, 3, 4, 5.
Or in the PACU or in the infusion centers.
Okay. So when they grab the people in the NICU, when they do grab that iPad, that iPad, it's not in single lap mode, but they're told to hit Jamf setup, or it's not obvious sometimes,
Yeah.
depending on how many icons you have visible.
We have the nurses trained to. They're typically it's the nurse that is presenting the iPad to them, but again, if they don't choose it, then the device won't wipe automatically. But again, they do have their big red button to press. What we do have a little but a little sheet next to the iPads providing some instructions on how to connect the device. Same as we have a little tent card on each of the in-room beds, a little tent card that says, here's how to access your room controls. Crestron is obvious to a lot of us in IT, maybe not a lot of folks in the real world, and so they may not understand that the Crestron app is how they control their room.
In the Bungee Foundation one, we have the wallpaper actually has press here to start, a big arrow that points at the dock, and then the icon literally says go on it. So it's pretty obvious what to do. Push the green button, and then you can go from there. And actually, once you launch that app at the Bungee Foundation one, it locks it in autonomous single app mode. So they can't get out of it until they make a selection, which is one way to get around that problem.
All right.
And then, again, like we said, they work together. It's not required. It's there to assist. The nurses already know to push the red button before they put the device in the to be clean tray.
Green go, red stop.
Yep.
Yeah.
All right. Thanks for your time.
Thank
you.
Yes, sir.
So a question around provisioning.
Around
So
provisioning.
You said you join the iPad to the provisioning network, and I assume at some point you then push out a profile that puts them on the proper network.
Yes.
How do you stop them from going back?
We don't want to stop them from going back. We stop them from the iPad from going back as when we push out that provisioning payload to say, here's the network you're supposed to join. We have that one with the auto rejoin or reconnect to network flag turned on.
Right.
We're also pushing out the payload for the provisioning network with that switch turned off. So when the iPad then goes to pick which network to join, it says, oh, here's the one that I'm set to auto join.
Do you find that reliable?
Yes, I do.
Okay.
If for some reason there was an issue with the Jamp commands not sending out correctly or that payload not being received correctly, we can have a technician or a patient or a nurse simply reconnect it to the provisioning network again, which will get it able to talk to the Jamp server, and then the Jamp server can continue pushing out the payloads to the device.
And just a follow-up to that, what kind of restrictions do you have on the provisioning network? Is it just you can see Jamf server and Apple?
Can you come just a little closer?
Sorry, what restrictions do you have on that provisioning network? So is it just Apple and Jamf, or can they do other things?
No, we limit it just to Apple so it can reach out to the activation servers and then...
Just APNS.
Yeah.
Yeah.
Cool.
Thank you.
Cool.
We have about 5 more minutes for questions, so we'll work through everybody else in line. If there's any additional questions...
Oh, we'll be here.
We'll be here at the Expo Hall.
Yeah. Thank you. Josh.
Just a really quick question. Can you describe, Eric, when you do choose from Jamf Setup each of those bed numbers, what's happening in Jamf Pro that allows that iPad then to be triggered by an ADT command?
Yeah, so in the ADT Healthcare Listener setup, we have a list of extension attributes that we're looking for. In different environments, we've found that we want to be able to scope different things different ways. So we have, for example, in our Jacobs Medical Center, we have one extension attribute that we're looking for, and others where we're not using the Crestron device where we don't have those, we have those under a different extension attribute. So that this way we can do more with the scoping of how those devices are receiving different payloads based off of what that room is. And then what the setup app is doing is then it's writing to one of the those extension attributes, and then we can then do the wipe based off of that extension attribute.
The healthcare listener can define whether it's listening for a room field or an extension attribute field, and then theoretically the ADT message feed coming from the interface team can be configured to be able to wipe what that matches, so that the ADT message may not necessarily be what the ADT, so the interface team can say, all right, this actually is going to be distributed like this with this terminology, and as long as that terminology matches the extension attribute, and those two things tie up together, it'll wipe.
Cool.
Yeah.
Thank you. Kind of a follow-up to that. So when the patients come in, do they use the ADT to actually register them in bedside, or do the nurses still scan the barcode to get them?
Yeah, great question. We are still using the method of, I don't even know what other methods there are because I really like this one. We really like the idea of the nurse knowing that, yes, this is a patient that we want to give access to their healthcare records, right? It's not a minor. It's not someone who shouldn't be seeing their healthcare record. We want to make sure that if there's a proxy issue, we want to know that the right person is seeing that data. So we have the nurse make that judgment call. They pull up the QR code. And then the patient may decide, you know what, I either do or I don't want to see my information. It's kind of a both ways, right? We want kind of that hand, to take it to a technology side, we want that handshake to happen where the nurse is saying yes, the patient's saying yes, and now we can scan the QR code, right? We want that to be a two-way street.
Okay.
Time for
Nick,
one.
Sorry, can I just ask real quick, because it was part of, since the Apple TVs can't handle Pro ADM signal, so do you have the TV directly on the smart TV, and then this comes in as a separate channel?
Yes.
Per se? Okay.
Yeah, and then
So-
we have it set up, of course, so that if someone activates AirPlay on their tablet, it'll automatically switch the input over. And then if they want to go back to the TV, they can either do it through the Crestron app, which is their iPad remote control for the TV, or the Pillow speaker also has channel control, and that would switch back.
Okay, cool. Thanks.
Thank you.
Had some questions around like ROI and cost justification. So as you're looking at this, there's expense, additional expense that might come into that. So you had a stat of 30%. The patients that are in the program using this access their digital health record, 30% of them. Are there other stats or examples, or how do you translate that into cost justification?
In yesterday's keynote, Mark gave some figures of how much money we've actually saved by automating this and not having IT involved at all. And really, I think he's kind of lowballing it a little bit. I think that those savings are a lot higher because those are taking hours away. Those are taking FTE hours away from what that staff is already supposed to be doing, to then go and service the tablet on every single wipe, right? Or every single setup. You know, we want that minimized. There's a lot of stairs in between these floors. It takes a long time to get from room to room in the facility. We want them to be spacious rooms, and we want them to be comfortable. That means more walking. It means more time to get from point A to point B. We've seen some really amazing things with our EMR system, and depending on what those numbers are calculated, our patients are accessing our EMR system 2 to 4 times the amount that our staff does. I think we have 4 times as many patients in numbers accessing the EMR than our staff numbers accessing the EMR. And of the requests that are being made to the EMR system at any given time, it's twice as many are being done by our staff, or being done by our patients than are being done by our staff. So, so that's an important thing.
So reduced need for them to actually come up and be on site post.
I'm sorry?
So that'll reduce maybe the number of times they'd actually have to come back and be on a brick and mortar, or they could be handled through telemedicine or remote. And therefore saving.
Right, or even if they're looking up their prescriptions or looking up what medications they're taking or how often to take that. You know, sometimes the instructions rub off on the bottle. They have a secondary way to see it. Maybe it's easier to read on the phone or their tablet than it is for them to read it off the bottle. So yeah, there's a lot of really good use cases for that I wouldn't even pretend to know, as I'm not even remotely clinical in any way, so please don't think that.
Thank you.
I'm merely just trying to do this for the experience factor. One last thing I wanted to point out that I forgot to bring up when we were talking about how the iPads are doing the provisioning. We're making use of a lot of the managed app config. For example, for the Crestron device, so we pre-populate as the Crestron app is downloading, we're pre-populating the username, password, IP address of that Crestron controller that it's talking to. So when the patient opens the Crestron app, it automatically opens and loads the config for the room that it's in. Again, not able to manipulate or affect a different patient's room. So
really cool stuff.
Yeah. So thank you very much.
Yeah, we're a few minutes over. Thank you so much for your time and your questions, everybody. Thank you, Eric.
Thank you.
Thank you, Paul. Thank you. Really appreciate it.